Hey everyone, welcome back. My name is Dr. Shayna Powell. I'm a registered naturopathic doctor in Montrose, Colorado, and owner of West Elks Wellness. New location sign coming soon to Townsend Avenue. I'm really excited about that. Um, Part of me taking a little bit of an early maternity leave before little dude actually comes is so I could move into my own office, which is really awesome. The way that I want to orient folks on this is going to be part one on pregnancy, things I've learned, planning on trying some experiments. Really, I'm looking at postpartum as very much a giant experiment because I'm a new mom. Like, I've never had a kid before. I don't know. And the other piece of this is many ways to skin a cat. So you have to take into consideration your own health concerns, your your traditions, your culture, blah blah blah, all the things. Like, this is not meant to be a judgment or this is the right way. This is the way that I'm like experimenting. And I want to share some of it with you guys because some people have had questions and I've had questions, and like I've asked other people, other moms that have tried things postpartum. So there will be a part two. So baby hasn't come yet. This episode will be released in December, so I'll have had a few months to try these ideas out. Some of which I have tried, but I just want to give you guys an idea of like, hey, idealism versus reality. So no wrong ways, many ways to skin a cat. Just keep saying that, okay? Uh, Finances, there are many things we have to consider. All right. So the most common symptom that I've heard is people that are pregnant are like, hey man, I am in so much pain. My feet, this, that, the other thing. Despite me having a condition called hypermobility syndrome, or it's on the Ehlers-Danlos spectrum, connective tissue disorder that causes ligament laxicity, which anybody that's been pregnant knows you get loose ligaments anyway. So I have that disposition. I've been pleasantly surprised with the not ton of pain I've had. It's mostly been a little more uncomfortable, like now, like later in pregnancy. But I've done a lot of body work, and what that means is hey, I know everybody knows massage. Anybody that's seen me in my private practice knows that I don't typically recommend massage as my first go-to. I usually recommend modalities that are supportive of the nerves and nerve conduction, much more gentle than massage. Massage does have a place, but again, with my health condition of hypermobility, massage is not the best body work for my body. So I have a bias there. So things that I have done, and I get this question: is visceral manipulation contraindicated, meaning you shouldn't do it during pregnancy? Absolutely not. It has been one of the best things, actually, for pregnancy. I mean, your uterus goes from like this big to 500 times that size and squishes everything around. And so, what visceral manipulation? It's massage or manipulation of the viscera. And we have a fantastic practitioner here in Montrose. I'm really grateful for his skill level here. He actually is like friendly with the guy that wrote the book. I haven't had the opportunity to meet Jean-Pierre Brel. He's a French doctor of osteopathy, like a proper osteopathic doctor. And visceral manipulation, like craniosacral therapy, both come from traditional osteopathic technique. Um, while Ted is not an osteopath, he is a body worker. He is very well trained in this modality. Highly recommend it. You're having rib pain. You're having, oh my God, my bladder's being kicked. I was having some gallbladder pain from little dude playing tetherball with it. Any of those things can be very, very helpful. And if you're dealing with constipation, which I know is another common symptom of pregnancy, even diarrhea too, like I can't stress regular body work. And for me, regular's been every 2 to 3 weeks getting visceral pretty much through the entire pregnancy. The other one, at my midwife's recommendation, I started seeing a chiropractor again. Chiropractic with hypermobility is hit or miss. And so I have been let's see, how do I say this? Less on it the last couple of weeks because of the relaxin, which is the hormone that gets released to help relax the connective tissue. So you can basically push a watermelon out of a hole this big. It's a little more nuanced than that, but that's the short and sweet of it. It has been very helpful though for back pain and just keeping things aligned. So one of the biggest things that my midwife has said to me is, When baby's in poor alignment, that's what makes labor take so long. So if baby's not sitting down in the birth canal properly in the right orientation, which is left occiput posterior, so kind of baby's belly is to your belly, mama, and you want head down, right? Like that's the easiest way. Breech is another way that babies can get pushed out. And I know in modern society, we say, oh my God, breech, we got to have a C-section. There are lots of tools to help spin a baby. Spinningbabies.com is a good one. And you basically sit in positions that aren't the most pleasant. They're not painful. They're just like, you're kind of laying with your butt up in the air, kind of like in puppy pose. If you've ever done that in yoga, that's one piece to like get baby to move. Move your body is very important. So when you get regular chiropractic adjustments, though, your hips tend to get adjusted when you see the chiropractor, and that keeps the pelvis in a good alignment so that baby's got like a straight shot. So I think that that's really valuable. Another modality that I'm a big fan of is orthobiotomy. I've had less of this, more of it in the beginning of the pregnancy, but less of it later on through pregnancy. Really recommend finding a good body worker. Both visceral orthobiotomy and then Bowen, which I haven't done through this pregnancy. The gal that's here in Montrose has been moving offices, but are all very gentle modalities. You shouldn't have pain or sensitivity, whereas chiropractic, it's a little more, how do I say, forceful. It's more direct versus indirect. So it's a little, they're more gentle modalities. Again, another, page out of an out of an osteopathic orthobiotomy. Foot zones. Okay, this is a weird one, but I really, really love them, and I'm a big advocate for them, especially for the rib pain that I've been experiencing, which has been my most obnoxious symptom that I've had. I've not had braces, but the only thing that I can even maybe compare it to is, my friends would say, I just got my braces tightened, and they do this like tighten, tighten, tighten. It kind of feels like that, except instead of tightening in, they're tightening out. And it's like, it's not painful, but it's unpleasant. It's maybe like a 4N, but it's a constant, just like being ripped apart from the inside. My friend was like, sounds like some kind of medieval torture. And I was like, I could relate to that. um, anyway, so foot zone. Okay, foot zones are massage of the feet. And similar to reflexology, they use various points on the feet to properly open and close the energetic pathways. It's about 30 minutes on each foot. I mean, come on, who doesn't want an hour-long foot massage? And it's the best foot massage that you'll ever have. So at my last appointment I had with Leslie here in town, I'm like, what are you massaging? And I hadn't told her that I was having rib pain, because up to that point, the visceral manipulation had been managing the rib pain. Like I'd go get a session, I wouldn't have pain for about 10 days, and then it would start creeping back in, at which point I was getting ready to see Ted again. And she's like rubbing on the bones on my foot right in here. If you imagine this is my foot, and they are super tender, like, oh my God, ow, like wincing. I was like, what is that point? And she's like, oh, those are your ribs. And I was like, oh my God, my ribs. So really helpful. Definitely a little on the weird side, but anybody that knows me knows, like, I'm not going to write something off because there's not a double-blind placebo-controlled study for it. Double-blind placebo-controlled studies are problematic and really exemplify pills, because you can't really hide broccoli in a randomized controlled placebo style. You either eat broccoli or you didn't. Like, you're having real broccoli or you're having broccoli in a pill form, right? It doesn't work for everything. I am a scientist at heart, which is why I'm approaching everything here with experiment attitude. Okay. And the other things are, you gotta move your body. Like, I can definitely tell the days, oh man, okay, I did a 20, 30-minute session of yoga. My back feels substantially better. I have a history of some bulging discs in my lumbar spine from an accident during childhood. And so back pain's been a little bit of a struggle for me, but as long as I stay moving my body, okay, those are things like squats and lunges have been super helpful. And I call those exercise snacks. I'm not doing like an hour of squats and lunges, but like, okay, 10 lunges on each side, 10 squats, and doing them throughout the day, like 10, 3 rounds of squats throughout the day, body weight push-ups. Like, these are humbling tasks when you're carrying around like a basketball lump of a little one. Okay. The other thing is, walking is hugely underrated as a physical activity. So if you've been dealing with like swelling and stuff like that, which I dealt with a lot more in the beginning of my pregnancy than I have in the latter parts, which has been interesting. Big recommendation. If you can do 2 20-minute walks a day, you're going to be feeling pretty dang good. Even if you can only do a 5-minute walk, better than zero. Penny's worth more than no penny. A little bit of movement is very, very helpful. Something this has been interesting. So a few years ago, maybe like 6 years ago now, I started switching from conventional sneakers, like conventional shoes, and started wearing barefoot zero drop shoes. Okay, so zero drop means that I don't have a shoe in here, but zero drop means, okay, so if you imagine this is the heel of the shoe and this is the front of the shoe where your toes go, a lot of times the heel of the shoe is elevated. Okay. And that is not a zero drop. It's like kind of elevating your heel. So it's a slight high heel, if you will. Okay. And zero drop means that the toe bed and the heel bed are exactly the same. Okay. And then barefoot has to do with the thickness of the sole of the shoe. Right. And please hear, this has been a process over the course of 6 years. I've seen people really harm their feet, cause plantar fasciitis, cause migraines, cause all kinds of things because they went from wearing a 2-inch shoe or like a Hoka shoe which has like a 3-inch heel on it. And yes, if you actually look at it, it's like, wow, those are like 2.5, 3 inches of puff. You cannot transition that quickly to barefoot shoes, which are between about 3 millimeters up to about 12 millimeters of sole thickness, depending on winter versus summer shoes. And it really does make a difference. I was like, I'll just wear my summer shoes through winter. No, like the feet lose too much heat that way. So it's worth getting a good pair of winter shoe. So where am I going with this? This was something I was really curious if would happen, because I hear all the time, like, one of the biggest things women complain about is my feet changed. I had to get rid of all my shoes. My feet got wide. My feet haven't changed at all. But over the course of 6 years prior to getting pregnant, my feet have changed. I went from on average about a size 8 shoe to about a size 9 in women's. And that's to accommodate my foot being foot shaped instead of shoe shaped. So squished, like pinky toe being tucked under, to like actually being able to have control over the muscles right in here. And I'm using my hand because our hands and our feet are actually very similar muscle and structurally speaking. Obviously, our toes aren't as long as our fingers, but we have these cool little muscles called the lumbricals on either side of our fingers, here and here, both sides. Okay. And our toes have them too. And we should be able to pick things up with our toes. And, while I'm not like out there doing like archery with my feet or brushing my teeth with my feet, I definitely have a lot more mobility with my feet. And the other thing that I've noticed about with the barefoot shoes and the not having any feet swelling and my shoes, I don't need new shoes. Like I've been able to wear my exact same shoes throughout the entire pregnancy, minus the humbling of putting clips on your shoes, because it's hard to bend over, has been no issue. So that's been an interesting observation. Let's see. Okay, so being an naturopathic doctor, being someone that's sensitive to smells and, dealt with multiple chemical sensitivity and all kinds of like toxic burden issues with my health over my, when I was a lot younger, in my teens and early 20s, balancing a low tox lifestyle with cost and risk benefit. And I like to think about like time use. All right. So car seats are a great example of this. You have an infant car seat, maybe for a year. You're going to tell me that I'm going to spend $500 for like the lowest tox, wool based, no flame retardant, blah, 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 car seat that I'm going to use for a year? No. How does that make any sense? Like, and some people have you make $600 million a year, fantastic. And money's not an issue. Not that money's an issue necessarily, but like I like to consider multiple factors in my decision making, and I don't just make a decision because it's the most expensive, therefore it must be the best. We have to take into consideration our own lifestyle. So something that I decided was like find something as far as on the low tox. When I say low tox, I'm talking about things like flame retardants, which are all over baby gear, baby clothes, um, which on one hand I understand, but the extra seconds, and it's literally seconds, that having flame retardant on baby gear gives a parent to be able to get their car out of out of a flaming car or a flaming house is so minimal. And the tricky problem is our skin is fat. Okay, it's a phospholipid bilayer. Okay, what that means is when we're talking about toxins, we our skin is quite absorbable. Okay, so you put on something like these flame retardants or polyethylene glycol PEG or petroleum based products, skincare. These are all fat soluble. Our skin is fat soluble, meaning we absorb it into our bloodstream. Okay. So you put your nice little, cute little, fresh newborn baby right in a brand new car seat that's full of flame retardants. They're going to start absorbing that into their skin. And while you would think that this shouldn't matter, the fact that we're in a chronic disease crisis where it's like 43% of children are overweight. When I was a kid, I don't even know, there was like maybe a couple kids and they all had like some pretty serious health issues that were overweight. um, like we can get into the statistics. I really encourage you guys to listen to Casey and Callie Means. Casey's a medical doctor. Her brother Callie used to work in the food and drug lobbying industry. Quite eye-opening for those of you that are unaware of how incestuous those communities can be. We'll say. But it does matter to, again, a penny's worth more than no penny. So while I'm not saying go and buy the most expensive low tox item, let's consider what we're doing. Now, one of the things that I really love to do is off gassing. So off gassing is, okay, I'm going to try to use an example. Maybe you guys have seen that or smelled this. I used to get these backpacks when I was a kid from Walmart. They were like $10 and they were like the size of my, small child body. They smelled terrible. Okay. And they smelled terrible when I was a kid. They smell terrible now as an adult. They smell equally terrible. They don't smell good. So that smell though is from the manufacturing process. Okay. And this is like a pretty high tox item in my mind. Manufactured as cheap as possible. God knows how those factories smell. You know they don't have good ventilation and circulation. So anyway, what you do is you take that backpack or the car seat or the clothes you got from your friend who uses Tide, and you go and put them outside. Off gas. Let the air circulate through the heat. If it's not like a super meltable plastic, putting it in the direct sun can be really helpful. So like clothes and blankets and stuff. The heat from the sun will also help to off gas some of those chemicals. So this is a way to like, okay, meet your financial needs with, hey, I don't have $600 million lying around to spend on baby gear, because holy cow, baby gear is insane for brand new stuff. I'm slightly, I shouldn't be shocked, but I am slightly shocked. So let it sit on your porch, open things up, unpack them for a little while. That's kind of what we did. And we did get things used. That's another great way to get things, not a car seat. We bought a car seat new, just for safety purposes, for my own peace of mind. But letting it sit on the porch, off gassing, let those chemicals evaporate. They're volatile, a lot of them. That's why you can smell them. Similar to like essential oils, those are volatile terpenes. Instead of it being a natural terpene, it's a chemical terpene, which is probably not true. It's not a terpene, but it's a chemical that's needing to be released, okay, and dissipate. There are a ton of social media accounts that were really helpful for just orienting me. A lot of people have opinions. A lot of people have affiliate accounts where they are getting money from selling, Nuna baby or whatever. I thought Nuna babies were way too heavy, so I decided against those. And again, the cost versus long-term use was something I was taking into consideration. Okay. So just know if you're new and you're like, okay, well, I'm trying to navigate this low tox lifestyle type of a thing. How do I do this? There's a lot of accounts on social media that you can find, look up, and just sing your feet under you. I'm not making any suggestions that you follow their guidance because I'm a do your own research kind of girl. And I will say there's a lot of accounts, for example, that recommend the bamboo diapers. And the reason I wouldn't recommend them is because the amount of heavy chemicals that go into processing bamboo to make it be a natural fiber. And they're pretty high up on most of the low tox lifestyle folks. Good to use. I w- I would be hesitant, knowing what I know about endocrine disruptors and chemicals are just. And again, we don't have double-blind controlled randomized placebo studies to prove that these are problematic. However, I will say with my own health journey that reducing my toxic exposure has made a huge difference in the quality of my health. You got migraines, you got weird skin stuff, it's worth putting the effort in my mind to make a big difference. And I've seen this be effective clinically. Yeah, that it's kind of shocking how sometimes it can be that simple. Change your cleaning chemicals. Okay. I want to talk about diapering. This is where I'm doing quite a bit of experimenting. I was inspired by some colleagues of mine when I was a student, exposed to early elimination communication. Let me show you this. So this is called a top hat potty. Okay, baby's obviously not here yet, so I'm not. This is experiment. Top hat is for newborns, and I think all the way up to maybe 12 months. Okay, each baby is going to have their own way of communicating. Hey, I need to take a pee. Hey, I need to take a poop. All right. So the thought in the early elimination communication world is that colicky babies, fussy babies, it's because we have a natural disposition to not wanting to shit our pants. And then we're basically training our babies to poop in a diaper. And I don't know about you, but I've accidentally had accidents in my underwear. And immediately I'm like, I need to take care of this yesterday. Right. And so I can only imagine a baby would probably feel somewhat similar. And then if you get mixing of urine and feces together, that can create a reaction that can cause a really gnarly skin rash that's painful. It's like burny and red and doesn't feel good on little baby bums. So I was inspired by some colleagues of mine back when I was a student. They had 3 babies in the time I knew them. All 3 of their babies were not entirely potty trained, but I would say 80-90% potty trained by the time they were 8 months. And I'm not joking when I would say this. They would go get the potty and sit on it. And this is for little babies. They make other ones that are a little more stable. So an older baby could go and sit on one. If you've seen the Bambino little baby chairs, they kind of look sort of like that. And really making the potties accessible, teaching them how to use. The problem I hear is, well, what if you have to do daycare? Daycare might not be willing to do this. This is going to be really time consuming, blah, blah, blah. From the readings and the forums I've spent time on while I've been pregnant, it doesn't really seem like it takes any more time than changing a diaper or washing cloth diapers. So this is one of my experiments. I'll let you know how it's going when I do part 2. Okay. Definitely going to do some cloth diapering, see how that goes. I have a pretty how do I say, I don't get overwhelmed by some things pretty easily. And I know my favorite reaction that I've heard from a family member is, yeah, cloth diapers are great for everything except cloth diapering. So I appreciate her candor about it. And I want to see, I know enough moms that have done cloth diapering. And again, this is one where I would grab get a couple of them because they make all these ones that are all in ones now. I feel like those are going to be a little clunky and kind of a pain in the butt to wash. So getting the pre-folds, which the sheets that you fold to be appropriately sized, and then you use a waterproof cover that are reusable. Anyway, so we'll see how that goes. And also doing disposable diapers. If we're going to be driving in the car, does it really make sense that I'm going to be climbing in the back seat, changing a wet cloth diaper? No, let me save myself some struggle and use a disposable diaper. Now, I did mention there's a lot of those accounts that say, hey, bamboo diapers are great. And I don't think so. So the biggest thing with diapers, the disposable diapers, and again, everything I'm saying is like what works for me, what works within my capacity, et cetera, et cetera. Okay. So having studied endocrine disruptors, plastics are my biggest concern. Yes, plastics and chemicals. Okay, so the anal genital region, the gooch between the genitals and the butthole, has been shrinking in our male population for the last 20, 30 years. Okay, this is a measurable outcome, and while it's not a randomized controlled placebo study, it is still something that is anatomically very important that we're paying attention to. Why? Because female babies, that is a smaller length than our boys, okay? So it's very concerning that our boys are becoming more feminine. What does this have to do with diapers? Well, most diapers are made from plastic. And we talked about earlier the skin being phobic and absorbing of fat soluble things. So petroleum, a byproduct of the oil industry, is what makes our plastics, okay? And plastic is fat soluble. The different types of plastic 1, 2, 3, 4, 5, 6, and 7. 2 and I'm forgetting. You'll have to look this up another time. But some of those plastics are more heat stable than others. 2 and 5, I believe, are more heat stable. And I don't know what types of plastics they're using in diapers, but I don't really want plastic touching my baby's genitals. Okay. So while there is plastic on the type of diapers that I've chosen to get, it's on the outside, not on the inside that are touching his skin. Okay. And that's something that's really important to me. Again, with those endocrine disrupting, endocrine is our hormones. And most of the plastics are estrogenic, meaning they mimic our estrogen. They look like estrogens. Hence that length is shrinking. These aren't testosterone mimics. These are estrogen mimics. Okay. So we're having more feminized boys and more female reproductive issues in women from these. So things like PCOS, endometriosis, breast cancer, uterine cancer, et cetera, are associated with too many estrogen, xenoestrogen exposures. Okay. So again, experimenting. I have plan A, B, and C with diapering. We're going to see, the other piece to consider with diapers is the dioxin, which is a byproduct of bleaching. Why? Again, this is kind of like tampons. Like, why do we need to have bleached cotton or bleached, little absorbable fibers? I don't, but I guess maybe we think, the industry thinks that we do. So then they bleach everything to make it nice, bright, and white. So you can really see that yellow meconium, right? I don't know. It's ridiculous in my opinion. It's not necessary. But again, dioxin is associated with a number of chronic health issues that are problematic. It's a carcinogen, et cetera, et cetera. So these are, this is kind of my thought process of how I decided to choose. And I'm really hopeful that the early elimination communication goes well, because it'll save me a lot of money, and not only money, but also like my kid will be potty trained, in a more reasonable amount of time. And I know the American Pediatric Academy, while I was in school, they increased the age of potty, the appropriate age for potty training between 2.5 and 3 years old. I was potty trained by the time I was 18 months. I know boys can be a little trickier to potty train in my experience when I was a nanny. I don't think, and this is me thinking and pondering and being curious, I don't think that 3-year-old kids are too dumb to be potty trained by the time they're 18 months. I honestly think it's an artifact of the fact that most parents now have to work full time, both mom and dad. And there's just genuinely not enough time. And not to put it on daycare, but daycare sure isn't going to be potty training our kids. Like, it requires a level of patience and commitment and like finding what works for your kid. So again, not poo-pooing anybody, but just like, why did this change? And we didn't have disposable diapers until the 60s. And I do think a lot of marketing gobbledygook starts playing a role here. I saw a cool ad of a I think she had to have been like Eastern European, and she had her little baby, and she had her baby peeing over like the garden, and this was like an ad from the turn of the 20th century. And it was a really cool ad because it shows like, hey, what did parents do prior to the advent of disposable diapers? So again, we'll see if this is some idealistic thought or if this is actually something that is reasonable. Because if it is, heck yeah. Um, okay, so nutrition has been huge, and I will admit I'm a stubborn person, and I want to eat what I want to eat. And as my midwife said, if you want to eat Fruit Loops and peanut butter and that's the only thing that you can eat, it's better than not eating. And I do agree with that, especially if you're dealing with that first trimester nausea, which I did not get with this pregnancy. So I'm really, this pregnancy's been pretty uneventful, quite honestly. I've been pleasantly surprised, and, it's been an interesting experiment. I'll just keep saying that. But protein is so critically important. Like, we are literally building a baby from an egg and a sperm, which are single-celled organelles in our body. Okay, and then we start building, and then we build an entire skeletal system. You need lots of calcium. Calcium is the most common mineral in the body. So lots of calcium and lots of protein, because pretty much everything, protein is the building block of the human body. So if you don't have enough protein, which is one of your macronutrients, the baby will steal it from you. And I mean this with all the love, but the first time I learned about pregnancy, I was like, that little thing's a freaking parasite. It's like taking everything from mom, but it's not a parasite in the way it's like, it's supportive of the next generation, which from a mammalian perspective, the whole point is to reproduce, have a baby, make the next generation, and then like that's the gift that we give as parents, as mammals, reproduce, pass our knowledge on. So from that perspective, it totally makes sense. So I was doing a better job about being protein focused, and I was really on a fruit train, still on a fruit train, eating fruit probably 3 to 5 or 6 times a day. Okay. And I'm very fortunate to live where I live, because it's like, hey, I just call the lady at the orchard and say, hey, I need a box of peaches, or I need a box of apples, or I need to get some pears, or whatever it is. And then I have a box of a box available for my peach consumption, which has been great for bowels, by the way, that soluble fiber. However, fruit does not contain protein. So even the government, which, take that with a grain of salt, the government says, hey, 90 grams of protein per day for pregnant women. That's a lot. The recommendation I typically make to my female patients, perimenopause, menopausal, going through trying to reverse osteoporosis, is 75 grams a day minimum. Okay. And that's tricky in and of itself to do, let alone 90. So basically, protein snacks. I've been eating a lot of tins of fish to try and keep that protein up. What I meant by being stubborn is, I like data. I'm a data oriented person. And so I got some labs drawn a couple weeks ago, and I've been feeling just a little tired and blah, blah, blah. I wasn't getting enough protein in, and my protein was really, really low on my complete metabolic panel. So it gave me that, like, hey, you need to be eating more protein and you need to be taking your calcium supplement. My prenatal that I have taken, and I'm not one of those people that's like, you got to take it every day, twice a day or whatever the bottle says. I listened to my body. And for me, it was about 4 times a week I was taking my prenatal. But it didn't have calcium in it. And anybody that's taken calcium pills knows they're giant horse pills about this big. So I don't love those. While I can swallow pills very well, I have a powdered calcium supplement that gives me about 1,200 milligrams of calcium, a little bit of vitamin D, magnesium, strontium, boron, et cetera, et cetera. Doesn't taste great, but it does the job. So making sure you're getting good calcium and protein is very helpful. Oh, the other thing, when you're getting a prenatal, as I don't eat eggs are a great source of food for a lot of people. They don't sit well with my body for whatever reason. Choline is an amino acid. Is it an amino acid? It's a B vitamin. Choline's a B vitamin that's really important for the nervous system development. And so look for a prenatal that has 300 milligrams of choline in it. The prenatal that I was taking has choline in it, so it made me feel all right about it. If you're eating eggs, eat several eggs a day and you'll be getting an adequate amount of choline, so don't worry about that. But definitely like one or the other or both, if you're not like the biggest egg connoisseur, I'll say. Let's see. I found Nourishing Traditions cookbook when I was dealing with all of my health issues, and then got swayed into the vegetarian vegan stuff again when I was in school, because again, I'm a data oriented person, and while there's a lot of really good data on veganism and vegetarianism, I don't think it works for everybody. And again, if it works for you and you feel great and vital and vibrant and excited in your skin and your hair and you feel good, awesome. I don't when I don't eat animal products. So, Nourishing Traditions, they also have a child and newborn baby care book. And they talk about like prenatal care, what kind of things to eat. Anybody that's familiar with the Weston A. Price Foundation, he was a dentist back in the early 1900s who quit his practice and went around the world and looked at indigenous cultures and was like, hey, what are they eating? I want to know about their teeth. And what he found overwhelmingly was that cultures that ate animal products, and even if they weren't eating meat, they were they were relying heavily on dairy and eggs to get their nutrient intake. So things that you can't find in the most bioavailable forms include iron, um, vitamin A, calcium. Let's see. Various types of protein. So, like, you have to mix beans and rice in order to get a complete protein. So, meat is a complete protein. What else? Vitamin A. God, my brain is being not ideal right now. But vitamin K, that was the other one I wanted to say. Vitamin K, vitamin A, vitamin D, which you can get from mushrooms, but everything in plants is a much less amount and it's not as bioavailable. And again, iron. These things are really important. Copper and zinc too are much, much higher and bioavailable in animal products than they are in plant-based products. Okay. And even taking supplements of them are not as good as getting them from a food-based source. So I am an advocate for that. Again, you do you. If being a vegetarian or vegan works great for you and you've been getting all of your nutritional requirements met, fantastic. I'm so glad for you. So Weston A. Price, it has to do with our teeth is what he found. So he was a dentist. He went around, checked out all these different tribes. These people didn't brush their teeth. Some people had like mossy type growth on their teeth, and they had perfectly straight teeth. So that's very curious. And one person I met recently, she was like, "Oh, are you following Weston A. Price and like getting your nutrition that way?" And I said, "Yeah." And she was like, "That's probably why you felt okay during your pregnancy." And I think it's an aspect, but it's not the only piece. Like everything is multifactorial and complex, and each pregnancy, each baby, and each season of our life are different and require different needs and support. So, take those into consideration. Everything is nuanced. God, if I've learned anything as I've gotten older, is like that's the wisdom of life, is like, wow, this is not a black and white conversation. There's a lot of moving pieces that need to be considered here. Now, what is one other book that I have been reading is called The Postnatal Depletion Cure. A lot of us have heard of postpartum depression. So this is written by I believe he's a medical doctor out of Australia. And he saw his wife get pregnant and really struggle coming out of it. We've all heard of postpartum depression, but what about postnatal depletion? So it's not depression, but it's basically a lack of macronutrients and micronutrients, are minerals. So a lot of those minerals I mentioned, like iron and copper and zinc, like these are things that our body gives to baby and is in an exponential form to like build baby, so we have a baby that comes out, right? And we need to be making sure we have the proper building tools in order to build. And I like his approach because it's very much how I approach things. Sometimes we have to supplement, and it's for a few months, maybe 3 to 6 months, maybe a year, depending on how depleted a person is of their nutrients. Get those built back up so that the body can do its job. One thing that always has blown my mind is like, you need zinc to make stomach acid, but you need stomach acid in order to absorb zinc. So we've got to take a little bit of zinc in order to start making stomach acid again. So that, I call it hand holding. We've got to hand hold the body so that it has the tools that it needs so that it can start kicking back on and doing it. The body wants to be healthy. And God, if pregnancy, and we'll see how labor and delivery go, is anything about but trusting the body, and like that the body knows and has this innate wisdom, I don't know anything else that has been so like humbling other than being pregnant. And like the body, I'm not telling the body to make the brain and the eyes and it's just doing it. It's like, all right, here's the timeline we have, time to do it. It's kind of cool. So that's the nutrition bit. Let's talk about some of the tools that I've used. History of having chronic reflux. I was a little bit scared of this. I will be quite honest with you, because I was worried I was going to be like having some serious, flashbacks to back in the day when I was up all night and like having, fire come up my throat. And while I've had only 2 or 3 of those nights, I will say I'm pleasantly surprised with the tools that I have been able to use. So cell salts, CELL, like cell in our body, salt. There are 12 of them. They are also known as tissue salts or Schuschler's tissue salts. 2 of them that I've used pretty consistently when I had reflux, which mostly the reflux I had was like mid, in my second trimester, which again, doesn't really make logical sense to me, because like you would think with less space that there would be more pressure and stress on the stomach, which just goes to show that doing the diaphragmatic breathing that I am always on people about when they have reflux really makes a big difference. And it lasts, like lasting. It's like lifting weights, like it has lasting effect. The 2 that I've used to help with reflux, and I would recommend having both of them on hand for pregnancy, is NatPhos, NATPHOS, and NatPhos, and NatMur, NATMUR. So those are sodium chloride, NatMur, and sodium phosphate, NatPhos. And what I noticed is when I was feeling more like just like a gaseous, the NatPhos worked better. When I was feeling actual like heartburn and regurgitation, the NatMur worked better. And that might be for myself, but what's great about cell salts compared to other flavors of homeopathy is they tend to be more symptom specific rather than like constitution or like individual specific. They're relatively inexpensive, and you just take a tab or 2. I don't think I had to take more than a tab or 2. And then my backup was, if the cell salts weren't working, which they worked 90% of the time, was I had chewable DGL, deglycerinated licorice, on hand. And what was really interesting, and I did not like this when I had chronic reflux back in the day, if it didn't work, it made it worse. And I don't really have a good explanation for that. And that might be just like a constitutional thing. If I drink licorice tea, I don't have that problem. It's just the DGL specifically. So I don't know what to tell you about that. Random thought. DGL. So a lot of people get weird about licorice because, oh my God, licorice is going to cause high blood pressure. Deglycerinated licorice does not have that concern at all. They took the glycerinic acid and threw it away. So it's a processed form of licorice where you get the demulcent and soothing benefits of licorice without the concern of the so-called hypertension that can happen. And remember, artificial licorice candy is not the same as licorice, the root. So just keep your eyes peeled when you see an article. I see one at least once a year of, oh, a man died and he ate artificial licorice flavored candy every day for the last year and had a heart attack and died because his blood pressure was high. Wait a minute. So is it the licorice that's causing high blood pressure, or is it the sugar that's causing the high blood pressure? I'm going to say it's the latter. We'll save that conversation for another time. Maybe I'll get my colleague, Dr. Eric Yarnell, on here, who is a science dweeb to the max in the best way possible. And he has a fantastic soapbox about licorice that I so appreciate. Okay, I definitely have taken some supplements. Yes, those handful of supplements I just mentioned were specifically for managing symptoms of reflux. Note that I didn't say anything about proton pump inhibitors and Tums. Okay, I did that path. That path didn't work for me. If someone's going to have a reaction to a drug, it's going to be your girl here. Okay, so like I'm pretty sensitive to those things. If that's the path you choose, fantastic for you. Nutrient depletion is going to be much more when you're suppressing stomach acid than when you're just like helping support the body. which, that's the naturopathic perspective on things, is like, are we supporting the body or are we stomping on the brake to tell the body, no, stop doing that? Okay. So some things that I have been taking that have been helpful: liver capsules to help with iron, fish oil. It really wasn't until like the last month that I've been like on a fish kick. So again, I listen to my body, and if I'm wanting something, I eat it. Um, I guess generally I really enjoy like food. And with the exception of couple like nostalgic things, like I called it bear cereal when I was a kid. It's called Golden Crisps. Makes my pee smell funny. Very high in sugar. God knows what else, whatever. It hit the nostalgic button, which is what I needed. And so it's like, had a couple boxes of those, didn't feel great, felt a little nauseous from having too much sugar, but it hit the moment, helped soothe my soul of like, I got that and was okay with it. Digestive enzymes more so in the beginning. I've needed them less now. And then, okay, the other two things that I've been messing around with. Okay. Yoni steams or vaginal steams. You don't need to be doing these throughout pregnancy. They're more for like labor and delivery prep, and then postpartum healing. So I don't know if you guys can see this here, but I'll read it out to you what I put in here. I blended up some herbs and I made a steam. And I'm all about making things accessible. The problem with a lot of some of these like ancient techniques is like, oh, now you need to buy this like $100 like stool thing that you sit over your steam, blah blah blah. I don't know about you, but I don't need any more things and stuff, knickknacks. So I was at uh, a festival about a month ago, and there was a postpartum doula who's trained in Ayurveda, and so she talked about steams and she talked about the belly wraps, which I'll talk about here in a minute. And what I really liked about her approach was, instead of going and buying $100 stool, you just find a like, those big silver mixing bowls. You most likely have one. A 12 or 13 inch fits in most toilets. So clean your toilet, put the mixing bowl in it. I'm doing about a half a cup of herb per 8 ounces, or excuse me, per 8 cups of hot water. And I found that the temperature that it feels the best is about 180, 185. And you're going to pour that water on there, let it sit for a minute, and then you're going to, bare bottomed, put the toilet lid down, so you're sitting on the toilet. You're going to back up into the toilet with your bum and sit down. Have a blanket or a towel, and if it gets a little too hot, 185 shouldn't burn you. Okay, this is like the whole thing. If you type this in, like, oh, vaginal steams, the two things that the conventional websites are going to say is like the herbs are going to give you a yeast infection, or that you're going to burn yourself. All right, if you burn yourself, just take the temperature of the water. Like, come on, let's common sense think about this. Like, it's not hard to not burn yourself if you know your way around a kitchen and with a thermometer. But what I found is, if it did get a little hot, just like take the blanket off, seemed to be okay. A 10-minute steam is plenty long enough, especially in the beginning. You don't need to be doing too crazy of a steam. 10 to 30 minutes is what I found. There's not actually a lot of really good resources on how to do this. It's mostly, and I talked to a colleague of mine that she uses these pretty regularly in her clinical practice. And I will be making these recommendations when I get back from leave for my patients with endo and menstrual regularity and stuff like that, because it just feels so good. So some that are in here. Mugwort's the lead, which is really helpful for deep warmth. And from an energetic perspective, birth is, we've talked about it. Like, you're using a lot of building material, so it's very metabolically intensive. And then you give birth and you lose all of that like buildup that you have. So it's a very depleting state. It's very cold. So mugwort's a little warming. It's not a hot herb, but it's a warming herb. Lavender, rose petal, marshmallow leaf as opposed to root. This was, I'm making a tea. I'm not doing a decoction, which is a longer boil. So figured that get a little bit of that gooey goodness, demulcent property. Some nettle leaf, some calendula flower, and raspberry leaf. So it's like pretty nice formula, really nice for healing, but nothing that's like too intense that like, oh my God, if you did this, unless you have an actual allergy to one or multiple of these herbs, it should be a pretty safe formula for most folks. I plan on doing maybe a couple more before baby comes, and then waiting a few days, probably yeah, just depending on how labor and delivery go, probably start about a week or so after delivery, and be doing them 3 times a week. And I might build up to that 30-minute time frame. I'll let you guys know how it went, but I'll tell you, it feels really nice. It's like smells good, feels good. It's like relaxing, and like, I'm visualizing like helping my body push baby out, and not clenching, because that's a problem that we use. We use our pelvic floor when we should be actually using our transverse abdominis, which is a muscle that goes right across the belly here. Okay, kind of squeeze and bear down, like kind of like you're taking a good poop, but not like constricting. Anyway, so belly wrap. Uh, uh, so there's a couple of these options that I want to just help you guys discern between. There are a lot of options available that are much easier to put on. And I will say that after washing mine and having it ready for postpartum and how long it is, oh my God, it's going to take like 30 minutes to an hour to put on. However, you guys can see in this picture here, you see the ones with the Velcro and how they're pretty much exclusively on the belly. The problem with these bands is they have an increased likelihood of prolapse. Okay, so prolapse can be your vagina, it can be your bladder, it can be your rectum. I don't really want any of those prolapses. I would like to have my organs stay inside of my abdomen or my pelvis. So, again, the lady that I learned about the yoni steams from, I learned also about the belly wrapping, and this is an Ayurvedic style. So, from India, out of Ayurveda, the traditional medicine that they use there. It's a style of belly wrapping. You can see on the first couple pictures where it's kind of like a certain braid or knot, and you want to start right at your like tailbone, right at your SI joints, where your hips kind of come together, where like the meat of your booty is. Okay, and then you want to come all the way up to your rib cage, right under your breasts. And there's a specific wrapping technique. While I haven't done it yet, I've watched a couple of videos. So again, this will be something I fill you guys in on and how this is working. Up to 6 hours a day for 6 weeks postpartum. What the thought is like, hey, your uterus just went from 500% its size, and it's like shrinking down dramatically. Your organs are needing a little support. We've got muscles and diastasis recti, where your abdominal muscles come apart a little bit. The lady who's teaching my birth class, she said her biggest one was 7 fingers wide. That's huge. Okay. So it's normal to get a little separation. And a lot of times that comes right back. For some women, I just want to make sure to give my body that extra support, to, close things up. And again, pregnancy and labor and delivery are really a depleting state for moms. And so I'm approaching everything with a sense of curiosity, but I also like I mean, I see women that didn't give their body the chance to heal, in menopause now. And the fact that they're having such a hard time in menopause, like Western culture does not support moms the way that other cultures tend to, or we used to, but we don't anymore. And it's kind of sad. So I'm really hopeful that like some of my experiences that I'm playing around with, and like the rules that the parameters of like, hey, like meal train and stuff like that, like really having good boundaries and not having my family and friends expect me to be able to host 3 days after baby's born. I'm not hosting. Like, go get yourself some water, make yourself some tea, but like, I need some help. Like, we need to shift our culture where like we expect moms to just bounce back immediately. Like, it's a state, and I really appreciate this orientation. So any of you that have had a psychedelic experience will be able to relate. You've been on psychedelics, you're coming down, you're still kind of in this like trance-like state. That is sort of what labor, delivery, and like the first month or so of postpartum is. You're in a different reality. Like, the veil is very, very, very thin. Okay, so any of my sensitives out there that like have a little more sensitivity to other realities or realms will catch what I'm saying. And again, like, the only thing that's been akin to that makes sense to me is kind of like coming down from a psychedelic trip. Okay. Functionally, I'll talk about midwives here in a minute. Last thing that, it's wet from me cleaning it. That Ayurvedic midwife or Ayurvedic postpartum doula, she recommended getting a peri bottle. This was like $7 on Amazon. She said she likes the ones, the extendable necks. For rinsing with warm water while you're peeing after delivery. So that makes sense to me. Like you're pushing a watermelon out of a hole this big, like the body is capable, but also like, again, let's support the tissue so that it can heal well. Last thing I want to talk about is midwives. Okay. I have chosen to do a home birth with a local midwife. Again, low risk, not concerns about any complications for the pregnancy and delivery, et cetera, et cetera. But there are a difference between nurse midwives and home birth midwives. So if you go to a birthing center, which we have one here in Grand Junction, the midwives there are fantastic. They are more conventionally focused. So like they're more tuned in, like, okay, and not to say the home birth midwives aren't able to take care of like, oh, postpartum hemorrhage, oh, the placenta's not detaching, oh, baby's not breathing, like we need to do CPR, like any of the things that are concerning, a home birth midwife knows how to do and what is an appropriate next step. So for example, my midwife, if I have a third degree tear, she won't do the sutures. She'll make a recommendation that I go see a surgeon that knows how to do the suturing appropriately, or an OB that knows how to do the suturing, just so it's done properly. So it's like important for someone to know their capacity and also know when, like, hey, like you need further medical intervention. Okay. A nurse midwife, what's great about them is if you do need to get transferred to the hospital, they still have capacity to treat you and be your provider. Okay. And so that's something that a lot of women find comforting. It's like, hey, I am low risk, but I have a family history of X, Y, and Z, or my previous birth, like I'm having a VBAC, which is vaginal birth after a cesarean. And they're concerned that they might need to have another cesarean again, whatever that might be. It might be helpful to have a nurse midwife. So just in case you do need to get transferred, that you have that capacity of keeping the same provider. And then hospital births. Again, like if you're high risk, you need to be induced because you have some health issues. Hospital birth can be really empowering too. And a lot of practitioners, especially if they work closely with a birthing center, are kind of getting like, hey, do you need to be so rough and tumble with babies or with moms? Like, can we allow mom the capacity to eat and get up off the bed and not be laboring on her back, which is arguably like the worst position for a mom to be laboring in, just not using gravity and whatnot. Um, so that being said, hospital births have a place. And if there is an emergency or family history or you're high risk or whatever the situation is, learn about the cascade of interventions. So you get Pitocin given to you for your induction. There are downstream effects that can then happen. And not saying they're bad or good, but just like, hey, it's worth learning about these cascade of interventions. And the thing that I've heard from other moms is, I'm just gonna. You'll hear the nurses say, I'm just gonna do this to your baby. I'm just gonna do this. I'm just gonna, give you an IV. You have the right to say no, or let me think about it, or hold off on that for a minute. It's your body, it's your pregnancy, it's your delivery, it's your baby. Like you have that capacity. And I really hope that any woman that needs to be in a hospital has someone that they feel like is a good advocate for them, because things happen so quickly. And again, you're in a very trance-like state. And so, whether it's a good partner or a doula or, a midwife that transferred you to the hospital because you needed more urgent care, those are all people that can be helpful to be advocates for you and your needs. So pregnancy part 1, we talked about a few different things. I will let you guys know how some of this goes, and it's been a pleasure to be pregnant, and I am also looking forward to having my body be my body again. Whatever that means. So this episode will go out in December, and I will do a follow-up episode that will come out in the later part of winter. Thank you guys so much for tuning in. If you found this to be helpful, insightful, inflammatory, hopefully not inflammatory, but you never know, that you share it with someone or you shoot me a comment. Liking and subscribing is the best way to support my channel. So I really appreciate any support there. And I hope you guys have a great rest of your day. Thank you so much.